We owe it to you as your healthcare provider to show you and to make you aware of everything that's going on in your mouth.
And we are very fortunate to have an incredible team of people that love to just do what they do every day. They do it for the people that they do it for. They care so much about what they're doing, and they see the difference that they're making in people's lives. And we're very lucky that everyone in the office loves being together, and we hear that from patients all the time.
Coming into this office is like a breath of fresh air. It wasn't that I was ever afraid of dentistry, but my reality, being a single parent and really establishing myself, I was afraid of, one, being judged by people.
I liked his style, and I knew he was a very progressive dentist, very modern in his techniques and so on, and I had confidence in him.
A lot of what we talk about doesn't involve pain, and so when we identify a lot of different areas, patients are sometimes skeptical about what's going on, and so dentists will sometimes hold back everything that's going on. We're not in the office to judge what you decide to do, but at the same time we are going to inform you of all the conditions that are going on in your mouth, and the truth is, because of the training that our entire office has had, we will identify some things that maybe haven't been identified in other offices. And that's sometimes difficult for people to hear. Everyone wants to come in and hear that they've got a perfect mouth and a perfect smile and everything is fantastic. But at the same time, it's our ethical and moral duty to tell you when things aren't ideal. And so that's why we take the time right from the beginning to show you what's going on, and then you can choose the level of care that you wish to receive from there.
Over the years I've had some issues with my smile, discoloration of teeth, one of them. Silver fillings. I have a lot of silver fillings.
When I was a little girl, I went to a dentist in Huntsville, and I wouldn't have freezing. I was absolutely terrified of the freezing. I wouldn't have any freezing when he filled my teeth or anything, and I was like 6, 7 years old. Was I afraid of dentists? Yes.
We understand that coming to our office is very difficult, especially if it's been a long time and you're worried about how much it's going to be and how much pain there's going to be. And so that first visit, that's where we try to set the stage to make people feel comfortable that this is a place of healing and support and education, and not a place of torture and embarrassment like it may have been when they were children.
Everybody is so friendly. The moment you walk in the door, everyone's greeting you.
The whole atmosphere was really welcoming, and that makes a big difference, I find.
You don't meet people like Dr. Drew like that very often, and coming into this office and having them embrace me like family, and not only me but my children now. I could never go to someone else.
When you have someone who's crying because they have never seen themselves look the way they do in the mirror with a new smile, or when you've taken away years and years of chronic pain and they don't know how to thank you enough, that really kind of changes how you approach the profession.
I can't afford to have a whole bunch of dentistry work done to my mouth. They never made me feel bad about that. Don't worry, we'll work with you and what you have.
Dr. Drew's people were there along the entire process with follow-up emails and follow-up phone calls, making sure that all of the sensitivity that I was experiencing was fixed, so that at the end result was I was very, very happy.